Recording in progress.
Okay. Hello, everyone. Thank you for joining us this afternoon. We're going to pause for just a moment to allow everyone to get situated that'll be joining us today, and then we'll get started. I want to welcome you all to the webinar today, Staffed Family Child Care Networks, Promising CCR&R Practices Community of Practice Spotlight. We're thrilled to have you here today, and we hope that you do find this webinar informative, that it meets your needs and truly supports your work. Next slide. This webinar includes myself, Shannon Cameron Quinn. I'm an early care and education specialist, and my colleague Anita Allison, training and technical assistance specialist, as well as guest presenters who we will introduce a little bit further into the presentation. Anita and myself are part of the Child Care Systems Building team here at Child Care Aware of America. We are a team that was formed in early 2022. Our team has been charged with developing and implementing solutions for specific challenges that are currently existing in the field of early learning. Some of those are supply building, supporting the establishment and improvement of home-based childcare and staff family childcare networks, disseminating resources, and providing technical assistance around effective business practices and business automation, while supporting the implementation work under the American Rescue Plan Act and any forthcoming federal investments in childcare. Next slide. The agenda has been laid out for all of you today. We'll be getting started by reviewing some of the work that we've been doing here at CCAOA around staff family childcare networks. We, as I mentioned, will be joined by several guest presenters further down into the presentation who will be highlighting their work and how they've shaped their services to fit the needs of family childcare in their states. And then we've saved just a few minutes at the end of the presentation for any questions or comments for our presenters. And we'll be wrapping up our time together with resources and an evaluation component. Next slide. So let's begin our time today by talking about what a staff family childcare network is and how this work came about. In our demanding change report released last year and within our childcare landscape analysis of 2021, it was noted that there has been a significant decline of family childcare and that this trend continues. Issues such as burnout, lack of appropriate professional development, low wages, the lack of benefits, coupled with the effects of the recent pandemic, has exhausted our home-based providers. We found that there's a dire need to identify and adopt strategies for our home-based providers. Some of those strategies include recruiting, supporting, and retaining home-based providers to enter and to stay in the field. Many CCR&Rs are enhancing their services and establishing new programming to support the ever-changing childcare landscape and to meet the needs of the current childcare workforce. Some of this innovative programming includes employing CCR&R staff that's specifically dedicated by title and practice to provide training and technical assistance that's devoted to home-based providers through their staff family childcare networks. That by definition are organizations that offer home-based childcare a menu of quality improvement services and supports, including technical assistance, training, and/or peer support delivered by a paid staff member. Next slide. To support CCR&R's ability to adapt their services or to work in partnership with others who are supporting home-based childcare providers by implementing or enhancing staff-family childcare networks, here at CCAOA, we developed and offered opportunity for peer support for CCR&Rs and state system leaders. Additionally, through this work, we set out to offer support to these CCR&Rs who are providing resources to family childcare providers in response to needs tied to emergency preparedness, multi-layered disaster, COVID-19 pandemic, and mental health. Beginning last year, CCAOA offered a peer learning community to 14 CCR&Rs across the country, and this meaningful network, Staff Family Childcare Network Peer Learning Community, was designed intentionally as a professional development opportunity where we encouraged participants to share results and learn from each other while relying on one another to increase their ability to achieve meaningful and significant progress. So we aim to create an opportunity in the true spirit of a PLC by working to connect people. We assisted in goal setting while measuring collective progress. We enabled a shared learning environment based on peer learning support built on best practice. Next slide. Beginning in early 2023 of this year, 5 of the original CCR&Rs from the PLC formed a community of practice entitled Staff Family Childcare Networks, Promising CCR&R Practices. This was an additional professional development opportunity with just a slightly different purpose. COPs, by definition, are groups of people who share a concern or a passion for something that they do and learn how to do it better by interacting through regularly facilitated networking opportunities. Individual members work to advance their own work while contributing to the larger field. So this work is achieved through a shared domain of interest that is relevant and also priority. And in this case, the COP was, the priority for the COP, the purpose was to provide various tips and strategies for CCR&Rs on what to consider when they were developing and maintaining staff family childcare networks, either within their own CCR&R or in partnership with other organizations. Next slide. So the COP provided relationship-based interactions that were in support of learning and exchange of knowledge and information. In turn, this provided an opportunity for participants to work together while problem solving and creating new ideas. It was a core group of practitioners with a shared practice, combining resources, experiences, stories, tools, and ways of addressing problems. In a period of 4 months, it was our intent to build upon the previous PLC experience and continue the work with increased momentum and results with the following goals in mind. And that was to partner with CCR&Rs within the COP to develop a comprehensive resource for other CCR&Rs and system levels leaders, and to spotlight CCR&Rs within the COP and to highlight their experience and how their services evolved for home-based childcare providers, and to provide and outline relevant research and resources from CCOA and other national organizations that provide supports and services to these networks. And finally, to incorporate the importance and benefit of the business supports within CCR&Rs and staff family childcare networks by utilizing the CCAOA Business Support Companion Guide for CCR&Rs. Next slide. So both group experiences provided great opportunity for participants to rely on each other in a professional and facilitated group setting, and to further explore possibilities for future support of family childcare providers in their service delivery areas. Throughout the experiences, each state team experienced significant progress and notable achievements that were the result of this hard work, determination, and intentional planning. We offered technical assistance in between our sessions together, giving teams the opportunity to utilize both a virtual office hour session, or we had one-on-one technical assistance sessions that were based on individual schedules. Teams used SMART goal planning to inform and guide their work. SMART being an acronym for specific, measurable, achievable, relevant, and time-bound. So we spent a lot of time planning and talking about big picture goals and how to really take those big goals and break them down to more attainable short-term goals that would be both motivating and inspire their work towards the end result. Next slide. With this work and the determination and momentum that participants gained throughout the last year, we can recognize several strong outcomes from these experiences. Participants had a group professional development experience that provided connections, building relationships, being able to learn together, having the opportunity to share knowledge, providing an additional layer of support for CCR&Rs that were looking for structured guidance and the opportunity for further communication, while all together sharing collective knowledge and skills that were specific to staff family child care networks. Many teams started with the important task of assessing the field. They were able to give family child care providers a voice in the need for support, looking at it from a starting point of either creating a network from the ground up or identifying those gaps and exploring additional needs to their already existing networks. The data provided great information and helped them really look at their goals and what next steps to take to implement some of this feedback into their current programming and also in their future work. The CCR&Rs worked together as a group to define where they were, where they'd like to be, and how to get there. There were many times that they had to shift or pivot. They had to tweak their goals based on feedback. They had to take their plans of action and evolve them into working plans of action. During this time, we started to see the implementation of these goals with positive and valuable progress being made, with measurable outcomes that translated to stronger family child care networks while implementing that fresh, responsive programming to the needs that they were serving. Existing networks were strengthened and new opportunities were added by being responsive to those needs through training, networking opportunities, improving and building upon existing services, and ongoing technical assistance opportunities. Next slide. Through this continued work as an organization and collaboratively with our CCR&Rs, we were able to develop a variety of resources to support their work, developing and establishing and maintaining staff family child care networks. We had 3 blogs developed designed with the intent to inform and reinforce the knowledge and understanding around the importance of the unique needs of home-based childcare and the benefits of a staff family child care network. We developed a resource compilation filled with research, trainings, supporting documentation, additional resources, all as embedded links throughout this entire document. Also, through the COP work, the CCR&Rs were able to collaboratively work with us, contributing to a tips and strategies document meant to be a resource for CCR&Rs on staff family child care networks. This resource is going to be out in the next few months, and I'm going to hand the floor over to my colleague, Anita, who's going to tell you just a little bit more about the development and the process of that throughout the COP. Anita?
Thank you, Shannon. Next slide. So it was great, and it is great to be with everyone today. And as Shannon described earlier, the goals of the Promising Practice COP, the first goal she shared was actually met by COP members partnering with us to develop this comprehensive resource for other CCR&Rs and other system level leaders to use as they examine the possibilities of starting a staff family child care network in their area. The resource we created together is entitled Tips and Strategies for Child Care Resource and Referrals on Staff Family Child Care Networks. Members of the COP were very critical in developing this resource and was created with best practices in mind and shaped by the members' experience, expertise, and their professional wisdom. Each COP session focused on a set of best practices around a topic or topics critical in developing staff family child care networks. Through facilitated discussion, COP members shared information, ideas, and feedback based on their experiences regarding each topic examined during that session. Extensive notes were taken by Child Care Aware of America staff members during both large group discussions and small breakout conversations as IT ideas, tips, and strategies were shared. Note takers captured specific quotes from COP members, which were incorporated into the document. Each section includes an introduction to the topic, the best practices, and the tips and strategies from COP members, as well as a spotlight section highlighting a COP member's work in that topical area. After each COP session and using the notes that were taken, each section was developed out and shared with COP members who then had an opportunity to review and provide feedback on that section of the resource. Their feedback was then incorporated into the document and shared at the next COP before going on to the next topic. This process took approximately a month for each topic, and the process continued for each section of the Tips and Strategies resource until the complete document was built out. I'll next share with you the topics with best practices that COP members examined with a few of the tips and strategies for each. Next slide. So you'll see here the different topical areas that we discussed, the summary of the best practices that we pulled together and that the members highlighted and discussed and shared and really delved into in their examination. First, looking at the best practices related to that and seeing how the work they're currently doing relates to the best practices and how they're implementing those best practices. So in total, the overall document itself starts with a purpose and a background, then dives into the tips and strategies for each one of these sections. The first being assessing provider needs. And as Shannon said, you know, we learned to gather that information and gather that how were they going to, if they were going to develop a staff family childcare network, how were they going to determine what it could look like, what it would involve, what the providers' needs, and gather the perspective of the home-based providers and their communities in order to be effective in the implementation of a staff family childcare network. So the first goal was to assess those provider needs, and we started out by sharing best practices related to planning and designing and implementing and using surveys to gather that kind of information. These best practices that we used were from the Office of Planning, Research, and Evaluation, or OPRE, and they outlined those steps that someone needs to take in order to be effective in that designing, planning, implementing a survey. So common themes for tips and strategies shared by COP members focused on building relationships in this process and building trust with providers so that they would be more open and willing to provide feedback honestly regarding their perceptions, what they needed, and maybe even the challenges in participating and what they perceived as barriers to participation. COP members also shared during that time that we must be aware that a survey might not always be the answer when you can assess those needs in different ways. So they might want to do focus groups or canvas calls or use social media apps or interviews and polls to gather information regarding the perception of the providers about what they need to see in a program that is intended to support them. So again, after that was shared, we gathered the information, we gathered the discussion, we gathered the quotations and their tips and feedback, and shared that and wrote that out and shared that at the next session, which focused on best practices for supporting staff. And what is staffing support is needed and includes best practices for hiring and retaining staff for Child Care Resource and Referral agencies. An example tip for staffing support that was shared multiple times in these discussions from the COP members' expertise and their experiences with supporting home-based providers was that we need to be more intentional towards supporting the culture of home-based childcare, which should be visited and revisited throughout any type of hiring or onboarding process and the continuing education process of CCR&R staff who will be working with home-based providers. So that was one of the huge tips that COP members had regarding the topic of staffing support and hiring and retaining staff. The third COP session, the topic COP members examined there was that of direct services. To that end, there are several best practices that guide the work to ensure that direct services are provided equitably and efficiently. And many of these best practices and direct supports, direct services come right out of the Child Care, oh my gosh, my brain, CCDF grant fund. Oh my gosh, my brain. For our COP purposes, these services were focused toward home-based childcare, specifically staff family childcare services, but are applicable across all settings served by CCR&R organizations. After examining those best practices, COP members discussed the topic, sharing examples, with one member saying we should make sure we offer business practices training to newly recruited providers to get them off to a great start. We shouldn't wait for them to begin failing or to start struggling. We should get them off on a great start right from the beginning by making sure they're in attendance or actively recruiting them into the business practices trainings that are being offered. Others tips was make sure we offer self-care activities and opportunities for peer connection, because home-based providers, as you know, report feeling isolated and in their own little world, and often don't have those opportunities to share their concerns with each other, not with those who they feel are in some kind of role that could evaluate them, but to know that somebody there is walking the same walk they're walking in the work that they're doing with children and families. And the fourth COP session focused on three very important topics for Child Care Resource and Referrals: that of advocacy, investment, and equity. Each topic has its own set of best practices, and COP members highlighted tips and strategies for each. Best practices on advocacy were discussed, which led to COP members sharing their experiences with tips for others, such as work with providers to advocate for the issues that concern the field, but also have meaning for them personally. If it doesn't have meaning for them, you won't be the best advocate for the change or the funding or the program you'd like to see. They also shared, make sure to have a guide or a few one-page information sheets that have some really strong, pertinent data to support providers in telling their stories, because they want that personal touch, but we want to make sure that we're backed by some hard data that makes the point for providers. So from the COP members, this was really important. We next moved on in this session to discussing investment, and investing in early care and education means funding proven programs and innovative strategies for children birth to age 5. ECE is an investment because the current costs result in numerous future benefits. These benefits are not just financial, they also include social well-being for both people and society. And COP members shared examples so that they could make sure to talk about investment and the importance of investment, that we need to help those in our communities understand the benefits of investing in early care and education, specifically in home-based childcare. So we need those stories from providers. We need that hard data. So in other words, so we can take that information and let them know, if you do this, this will benefit our children and families into the future. And members also shared that we need to teach businesses and stakeholders that they can invest in the business aspect of home-based childcare. So they felt this was important to make sure that we impart to the CCR&R field in broad terms. Then we moved on to discussing equity during the last part of our COP, of our last session. According to New America, to approach education through the lens of equity is to acknowledge the disenfranchisement and discrimination faced by children, families, and teachers, and to create schools and systems that eradicate barriers to success, empower children and families, and inspire a more just society. Best practices on supporting equity were shared, and COP members then offered their tips from their experiences and their expertise that they have found effective in this work. And they said that advocating against discriminatory practices that compromise the quality of home-based childcare and the security of providers is of utmost importance, and that we need to have representation from the communities or populations or groups being served, with one COP member stating we need to have that representation because sometimes people don't hear who they don't see. And then lastly, one of the tips shared was examine how equity issues appear and how we communicate with our home-based childcare providers, such as language barriers and translation issues faced by providers, and in the way we are now providing many of our services through technology, and how this can impact equity across our field. You will find much more detail within the resource itself when it's published. I want to thank the COP members for their contribution to this document, their participation in the process, sharing their tips and strategies, their enthusiasm for collaborating with us, and providing feedback to make this a strong and usable document was invaluable, and I treasure the work we did together. So thank you very much, and Shannon, I will now turn it back to you.
Thanks, Anita. I appreciate that summary. I know all the hard work that went into this document, and I know I speak for both of us and our COP members that we're really looking forward to seeing the completed resource and being able to share that in the coming months. So thank you for that. Next, you can do next slide, please. I'm going to be introducing our guest presenters today. They're here today to highlight their community of practice experience and how their services have evolved to service home-based childcare providers throughout their participation. And you'll notice that the chat box, or the question chat box, is enabled. So if you have a question for a presenter during their presentation or a comment, you can go ahead and put that in there, and we'll take a look at those as we get near the end of the presentation. So today we have Sarah Zhang and Alicia Smith, both from Action for Children in Ohio. We also have Maggie Fern from 4C Community Coordinated Childcare in Illinois. Lindsay Insomnia and Colette Sawyer are joining us from Oklahoma Partnership for School Readiness Foundation Incorporated. So welcome to all of you, and thank you for joining us. We are going to start our presentations with Maggie Fern from 4C Community Coordinated Childcare. Next slide.
Okay. Thank you. I, again, am Maggie from 4C. When we started, we wanted to name our staff family childcare network, Family Childcare Connections. So that is the name that we did go with. Again, we are located in Illinois. So this is our name. We can go ahead and go to the next slide. Our Family Childcare Connections group is a way that we wanted to reach out to the providers. We wanted to get their input of what they were looking for in the staff network, what they wanted to get out of it, what resources they wanted. So in order to do that, we did start with a survey. We surveyed all of our home providers through a Google form. We asked them to participate in that form via email, via snail mail. We called them. We reached out as much as we could to try to get their input to fill out their survey and the interest level of what they wanted. So again, we did use a Google form. Here's the beginning of it. And if we go to the next slide, we can kind of see the questions that we did ask. So we got their information. We have a couple different counties that we serve. So we did go ask them what county they were from, just so to see if like the input in one area was bigger than the other. But we did kind of want to keep them all together so the network could was able to connect with each other. We asked what topics they're looking for, if they preferred in person, what time of day, what days of the week, and just kind of, we wanted to make sure that we were thinking of them and their needs when we started this network. We can go to the next slide. So we left that survey open for, I think it was about 3 weeks, and then we collected all the data. Here's some of the data that we did get out of it when asking. So we were able to collect all this data and kind of go from there and pick the best date that was available, the best time of day. And from that, we were able to determine that we wanted to keep it within the same week, but we would change days because as you see on this form, the days of the week were very varied. And we wanted to be able to keep it open. So if someone couldn't attend on Tuesdays, we didn't only want the meetings to be on Tuesdays. So we did move it around, but we did keep it in with like the same week of the month, so like the first week of the month. It was over Zoom because our counties are kind of far apart, but we also did it in the evening because they preferred that evening answer over weekends as well. We asked them, as you can see on this page, what their topics that they were interested in talking about with each other or with us. And then we kind of reviewed it. The next slide, please. This is where we planned what we were going to do and when we were going to do it. So this is the initial invite that we sent out to these providers. We sent it via email and snail mail. And we planned out the first 6 months of meetings. That way we could pencil it in, they would know about it. And it was, you could see that it was the first week of the month and that would change days. We planned this out, and then for each of those days, we had a different topic and a different guest speaker. And we also we did phone calls to remind them that the first meeting was coming up. So this was the flyer that we did send out. And I think that's it for this slide, so we can go ahead and move on. So after we sent that initial flyer, we did do monthly flyers. We posted these on Facebook, we emailed these, we mailed them out as well. So each flyer was for the specific month. So we have this one from January. We had a representative from Birth to 5. We have that in Illinois. And they came to talk about the groups that they have, the meetings they hold. The next one we did, that was our first one. So that was just us from our CCR&R, and we talked about what we offer them. We talked about curriculum planning and different kinds of curriculum if they wanted help with that. So those are the first 2 flyers that we did send out. The next page, the next slide has more flyers. We have our higher education navigators. We have them as well to find scholarships to help these providers go back to school to further their education. So we had them come and talk about opportunities that are available for them. And then the next slide we have is talking about an early intervention program that we have in one of our counties. They were able to cover all of our counties. So they did talk about options or different assessments to use that the providers had access to, or resources that they could contact if they were struggling with any families or any children, or just kind of a resource or a resource to touch base so these providers know that they do have other sources other than themselves and the families. We wanted them to know that we were here, and so were these other agencies that are available to them as well. So that was our idea behind having guest speakers show up to each of our meetings for the Staff Family Child Care Network. We wanted to bring it in a different angle. We also had a food program come in and many other different options as well. So we were trying to bring it in, going off of their ideas of different resources they wanted. We can go ahead and go to the next slide. On top of the Staff Family Child Care Network meetings that we had once a month for about an hour and a half, we also have Basecamp. Basecamp is an online database where providers can communicate and access resources that we provide. It is a way that these providers can log on, not necessarily during the hour that we are on, but they can access this database anytime they may need. They can get resources that are available and just kind of go at their own pace if needed. So we can go to the next slide and see what this Basecamp looks like. So this is the home page of Basecamp that when they log in after they've created an account, this is what they see. That first part where it says message board is in a space where they can kind of communicate with one another. They're able to send messages, ask questions, and go back and forth. The to-do is if there's anything coming up, any required trainings that they may have or that the state may have, we can put in there. We have docs and files, and that is where we put different flyers, different information, our Child Care Assistance Program information. We have tax documents. I have another page later that I can show you more information on that. Down there, we have a schedule. So if there's any big events coming up, or if we're hosting something, or just kind of like little events throughout our community that we have that we can showcase there as well. We can go to the next slide, and this is a closer look at the docs and files webpage. Here we have different flyers and information for our family child care providers in our counties. We have that higher education navigator paperwork, so the scholarship information that has their contact information. We have our child care assistance program that has all of the rates that are available, what they would be paid if they accept that program. We also have Tom Copeland information and tax information. And then we also have our 4C pop-up flyer. We do go out into our community once a month as well and hit those communities that are a little further than us, so they don't have to come to our office, but we come to them. So we have that information, so they're able to access that as well. And then we can go to the next slide. And this is that schedule I was talking about. So here I added different events we had for them coming up, our spotlight events. I also would add our trainings in there, or our staff family sharing connections meeting, our family child care connections meetings that would happen. And I would also include the Zoom link in here. So in case they did lose that email, they did have access to it other places, because we all know that happens. The next slide, please. We have our spotlight events for our providers. We had 3 separate events for our providers. We have 6 counties, so we separated into 2 counties per event. So we can go to the next slide. We called it the spotlight on family child care providers because we wanted to spotlight these providers. We wanted to recognize all the hard work that they already do. We wanted to make them feel special, and that it was for them, because it was. So we had lunch catered in. We had a keynote speaker to highlight all the great things that they do and to help them acknowledge that they are doing great things. We had giveaways and a lunch and some snacks and just a good time all around. So to do this event, we can go to the next slide. We made specialized invites and we mailed them out. They were like real invites from Walgreens and not just flyers for our licensed providers. So the event was broken into 2 parts. The first half of the event was for our licensed providers and license exempt. So providers we already worked with. We sent them that made an invitation, and they came to the morning part that had breakfast and then a keynote speaker, and then they stayed for lunch. After that lunch, they could then go home. They were done for the day. But then during that lunch, we had people who were interested in starting a family child care. They could come for that lunch, and then they would stay after for that second half, and we would talk to them about what you need to start a family child care, the requirements that our state has, different resources that we can offer them, and how we can help. So it was kind of split up, but we wanted that lunchtime where we had both of the people there, family or licensed and license exempt families and people who were interested in starting it, meet so they can kind of bond together and ask any questions they may have as well. So if we go into the next slide, we can see the flyers that we did make. The brown one we have here is the one that we did mail out to providers and license exempt providers that we already worked with. So that was their individualized invitation, and it had the RSVP information on that as well. The middle flyer is the flyer that we made, and that was to send with the brown flyer to families or to providers that weren't licensed yet through the state. So I wanted to invite them to come to that second half to see what options they did have to become licensed. So that one kind of went together for license exempt. The brown one was just for licensed. And this other one was a QR code over here. That one we put up in all of our communities. So if anyone was interested in becoming a provider, they could attend that second half. We wanted them to know that they were welcome. We wanted them to know that if they are interested, we are here and available to help out. So those are the 3 flyers that we did make. And again, we just wanted to encourage them that this is our spotlight on you, and we are so grateful for everything that they do. We can go to the next slide. And this was our agenda from our spotlight events. Like I said, this was just for the morning part event with our keynote speaker. It was a great event. They had a great time. The keynote speaker was great. They empowered them, and we had a great time. So this was just kind of the agenda and our speaker. We can go to the next slide. As we go through some photos, these are our giveaways. We had Tom Copeland, a set of those books. We had a gift basket of self-care items and different things that they could take care of themselves with. And then we also had a gift card with a children puzzle, or I had some games and another one. So this is kind of the check-in area and the raffle giveaway. We can go ahead to the next slide. These are the welcome signs that we had in our centerpieces for the providers. We had the centerpieces of the giveaway too as a raffle, and we could keep going to the next slide. I'm sorry. These are our I'm sorry. Can we go back one more? I'm sorry. There we go. This is our higher education navigators. They also attended our event to connect with any of the providers if they had any paperwork they could turn in. So they also attended our event to connect with them. The next slide are the goodie bags that we did provide everyone who attended. We had some cups in there, some notebooks and different things for the providers as well to use, just to know that you are appreciated. And we are really grateful for them with our business cards, so they are able to contact us with any questions. And the next slide. And this is our keynote speaker. She was Kristen. She is from one of the colleges around us, and she does encourage those early childhood educators to come out, and we are thankful for her and everything she taught us throughout this presentation. And I think that wraps up my part of the presentation and how we did our Staff Family Child Care Network.
Thanks, Maggie. We can go to the next slide. I appreciate you sharing all of that wonderful work you've done in a short amount of time. So thanks for sharing.
Thank you.
We can go next slide. And next slide. Great. I'm going to now turn the floor over to Colette Sawyer and Lindsay Insomnia from Oklahoma Partnership for School Readiness Foundation.
Hi, thanks for having us. We are super excited to share our story, and I have to give you the backstory to let you know how far we've come. So our story actually starts back in 2021 when providers were quitting. They were closing their doors because of COVID. And so we had heard from them. We heard they felt isolated, they felt alone, they felt underappreciated. And so our state said, we have to do something to support childcare providers, both centers and homes. And so we started by hiring business consultants to work across our state. And so there was one business consultant in each of our 8 regions working for our local resource and referral offices. And those business consultants provided training, they provided TA with both homes and centers. And we worked on self-care, business practices, leadership skills, but we were really limited on what we were able to do with the Staff Family Child Care Network. We knew that that was the vision of the state, but we did not have a lot of funding for it. So we were really just doing the basics. So you can go ahead and go to the next slide now. So then we received a request from Oklahoma Human Services who said, hey, we really want to invest in family child care. We need to make it a high priority. And so they asked us to write a proposal to really start up the Staff Family Child Care Network and with them funding it. And so we began to do the research, we got information. That's when we did join Child Care Aware of America and the peer learning community. And we began to really understand, what does a Staff Family Child Care Network look like? What can it look like for Oklahoma? And we just began to really seek out those answers. And we put through the request to Oklahoma Human Services to sponsor it. As we were doing that, we, again, because we were working with Child Care Aware, we began to write those SMART goals that they mentioned earlier in the webinar. And so, again, at this point, we still didn't have a whole lot of extra funding. So we were focused on just those small steps. And then we were focused on a conference. And so that's where our SMART goals kind of started, was thinking about what could we do and could we do a conference. And so we wrote a sub-grant for the conference. You can go ahead and go to the next slide, please. And as we did that, we made a request. It switched. Okay, so we made that request, and in that we included a proposal to do regional and state ambassadors. And I'm going to share a little bit more later on in this presentation about what that means and who regional and state ambassadors are. But we also put proposal NAFFC memberships, we were able to dream big because they told us to dream big. And so we asked for the highest level of membership that would also allow the home providers to have free training that would help them obtain their CDAs. And then we also added in the self-study kits for accreditation. So for homes who said, yes, I want to take that next step, I want to become nationally accredited, we asked for funding to support them and give them their self-study kit to help them start. Again, because we had already been working with some programs, we had already given a number of programs a child care management software system called Brightwheel. But as we really launched the network, we wanted to make sure that anybody who wasn't already working with us and already receiving that had an opportunity to have that management software system. So we added Brightwheel back into this new proposal as well. You can go ahead and change slides. And again, we were ecstatic, we dreamed big, but we got it. And so our estate said, yes, we believe in this, we want it to happen. And so they fully funded everything we asked for, including giving us our new position of having a staff family child care manager who's on the call with us today, Lindsay. And so she started and she jumped right in with us and started focusing in on the homes. And then we had the business consultants that I mentioned before. There was one in every region because our metro areas are very large. This funding allowed us to add a business consultant to each of those levels as well. So now they have 2, and you can go ahead and switch slides. The other thing that we were able to add was, I mentioned before that we had ambassadors, both a state ambassador and 8 regional ambassadors. Our ambassadors are family childcare home providers who are in business. They're operating their family childcare homes right now. They are in good standing with licensing. Most of them are accredited. And we wanted to have them to be mentors, to work alongside our business consultants, but to be mentors to other family childcare providers and help them draw into our network. So with that funding, we're able to pay them $25 an hour to work with us for roughly about 10 hours a month. And then we also pay for their substitute. So when they're joining us during a daytime event, whether it's our quarterly meeting or something else, then we have money available to pay their substitute, so they're not out any expenses at all. You can go ahead and go to the next slide, please. Each of those ambassadors are independently contracted with the region. So as a state, we don't hire them. Every region hires them themselves. And they began to look and they would talk about who's already advocating for early childhood, who's advocating for family childcare homes, who's in good standing with DHS, who's accredited, and they really looked at that. And so then we gave the regions a sample of what that contract could look like, and that's what you're seeing on this page. We also gave them a scope of work that DHS had provided that said this is what we would like to see the ambassadors do. So we sent that to the regions, and then we let them contract with their own ambassadors and join them on to our team. Next slide, please. So again, this is our first quarterly meeting that we had, and this was all of our business consultants and all of our regional and state ambassadors meeting together to start talking about what does a staff family childcare network look like? How are we going to make this work? Alongside those 8 that I mentioned, we also had the state ambassador, and that is somebody that from our office we actually engaged with, and we asked her to help us engage with the other providers and be a resource to our ambassadors throughout the state. And she has done an amazing job already. The other thing we added, and it's been really, really powerful, is we have a Hispanic ambassador. And so along with one of our staff members in our office, they are leading a family child care provider group that is Hispanic based so that they can speak a language that they're most comfortable with and feel at home with. And we're really, truly, the desire is to really let this be provider led and providers helping other providers. So just being those mentors, and we've seen that already take place. So next slide. So a part of our network included monthly trainings with networking opportunities and food. And again, our state really valued this work and said, let's do this and let's do it right. So each of our regions were given money, they were giving funded to go ahead and not only provide food, but enough money that they could bring trainers in each month, high quality trainers. So they've been doing that now since February. And had great success with that. And then again, I mentioned those quarterly meetings. So the quarterly planning meetings, again, are when the business consultants, the staff from our office, and the ambassadors all get together just to really learn from each other, figure out what our providers across the state need and how we can best serve them. The other part we added, and we're super thrilled, and this is the part we started with Child Care of America before we even got the funding from our state, was to do an annual family child care home provider conference. Our state had one way back in the day, but they have really missed it. And so we wanted to do a conference focused on them, one that would really meet their needs, because when they go to a conference that's primarily for centers, they're not getting the answers and the training and the resources they need. So we wanted to do something that would be just for them. And so that's coming up, and I'll tell you more about that in a couple of slides. The other thing we added was a monthly business blast home edition. We send this out each month with a different theme, with information that is just pertinent to the home. So whether it's business, whether it's leadership, whether it's tips on using that child care management software system that we've given them, whether it's just a little bit of motivation, something letting them know how much we care about them. So that goes out to them each month as well. Next slide, please. We have already begun receiving great feedback from all of the regions. Was kind of tough getting it started. We do meet for the providers, their training and working is one Saturday a month for 4 hours. So there was lots of talk about how hard that would be for providers, how hard it is on staff. But overwhelmingly, what we have heard back is it has been worth it. The providers have really appreciated it. And I mentioned earlier how they felt so isolated and so underappreciated, that now they're beginning to really sense that, you know what, our work does matter and people do see what we're doing and they do care. And we've been able to provide them with resources. Every time we do a monthly training, they're also receiving resources that go along with that training just to equip them and encourage them and again, help them feel valued. The words we get back are that it's just priceless, that the relationships that are forming, the networking that is happening is just something that is a dream come true for many of them. So they're really strengthened by it. And so we're really grateful that we've been able to do that. Homes, we know they are in the forefront. And so they are a big part of keeping our economy going and knowing that people appreciate what they're doing and caring for the kids. Many of these homes that we're working with didn't close one day during the COVID epidemic. And so it's just nice to be able to give back to them and help them know how much we care. So next slide, please. So again, we talked about how we really didn't want to come in as a state and say, this is what we're going to do and this is how we're going to do it. We wanted to come in and say, what do you want and how can we serve you and what do you need from us? And so in these meetings, we've really talked about what do you want? As we began to think about the conference, we talked to them about what kind of vendors they would want, what speakers did they want, where should we have it even? So and the ambassadors represent all of the family child care home providers as well. So, and the business consultants are out there working with them. So we get a good feel of what they want, and then we plan around what they say, and we really try to take it to where they want it, not just where we think they need to be. Next slide, please. And that leads us to what we're super, super excited about, which is our conference. And so we are doing our conference this Saturday. So Lindsay and I both have been a little bit crazy the last couple of days because it's coming fast and soon, but it will be held this Saturday at the Boathouse. And you can see from the picture, it is absolutely beautiful. Where the participants will be sitting will allow them to see the water and just relax and be joyful during that conference. So we're really super excited about that. Next slide. We have 2 presenters coming, and they are powerful, amazing speakers. One of them I know personally, the other one I've got to meet on Zoom and develop a relationship with her. But Erin Ramsey is going to do our first session in the morning, and she's going to be talking about choosing joy and how we each make that decision for ourselves and how to make sure that we don't let circumstances rule our life, but we let joy reign in our hearts. Barbara Sorrells is from Oklahoma, and she is going to be talking about creating a joyful environment. So Barbara and I had talked about, I had heard her do many, many trainings, but she did a training for child care centers on making your centers more home-like so that the children could thrive. And so I spoke with her and I said, Barbara, I think we need to capitalize on this. Our homes have an amazing environment for these children to grow up and thrive in. Let's talk to the homes about really being grateful for what they have and capitalizing on that and not trying to look like a child care center. Use the home to their advantage. And so she's going to be talking to them about their homes and just creating such a joyful environment for the children to learn and grow in. They're going to get 6 hours of professional development hours of training. Another thing they're going to receive, because we were very well funded, is a resource bag. They are actually receiving, I think it's about $175 worth of resources that we're going to be gifting them at the end of the conference. These resources were picked based on what both of our speakers recommended, and then we threw in a few little extras as well. So they're going to be, they don't even know this yet. You guys are going to hear this before they do, but they're getting journals and journal pens. They're getting lavender plants. They're getting a root garden where they can plant seeds and watch the roots grow underneath the ground. They're getting dancing ribbons, so many amazing things. And we're hoping, again, just to help them know that they are valued and appreciated and the work they do matters. And we just want to invest in them. The other thing we were able to do was for providers who lived over 100 miles away, they were able to request a hotel room, and we're providing that for them free as well. We did charge a fee, by the way. So we did charge $25 to attend the conference, just so that we had a little bit of buy-in and we knew that if you registered, you really were planning on attending. But for $25, they are getting so much more. They're getting the training, the resource, and some of them even that hotel room. So we're looking forward to that. That'll be Saturday in just 2 days. So next slide, please. And this is just the beginning. Again, this started with a dream way back in 21, way back, I guess that's a couple years ago, but just with what could we do for them? Little funding, but we were able to do the TA and the training, to now we're really investing in them. And so we're super excited because not only have we done that, but we're now working on other projects. Lindsay is taking the lead on all of this now, and she's working on a digital platform or a portal on our website, some way that we can let the providers kind of like our last speaker shared about base camp, something that will allow them to interact with one another. We've engaged with a marketing campaign who's going to help us get that catchy nickname and really promote the network and help build it and grow it. Again, we just want to meet the needs of our providers. And we also want to say thank you to Child Care of America, because we truly believe this community of practice was so valuable. I know Taffy, who started this project with me, when we first started it, we weren't even sure what the definition of a staff family child care network was. And so we were learning and growing together, trying to find out what that meant and how we could grow it. And in just a short year, we've come so far, and Child Care of America is a part of that. So thank you very much. And that's it for me.
Well, we thank you too, Kala, and your team. It's been a pleasure working with you. And I really appreciate you adding that provider feedback in your presentation. It's so important to see all of that hard work is paying off and giving the support that's needed. And I wish you the best of luck at your first conference on Saturday. It looks like it's going to be an amazing day. So thanks again for sharing. Next, our final presenters today are Alicia Smith and Sarah Zhang from Action for Children in Ohio. And I'm going to turn the floor over to you, Alicia.
All right, thank you very much. Thank you everyone for having us. So Action for Children, Central Ohio's Child Care Resource Referral Agency. So we are happy to be able to celebrate the establishment of a new community of family child care professionals. Next slide. So what have we been up to? So we have been on a very fast track to get Central Ohio's very first staff family child care network up and running. So we started with our pre-launch activities, which included surveys. We sent out surveys to all of the family child care programs, which were in our service delivery area of our home county, which is Franklin County, where the capital of Ohio is, and all the surrounding counties. So we sent out surveys to 294 different programs, asking about the needs, the wants, the types of things that were missing, the things that were available that needed to continue. So from that survey, we invited a group of family child care professionals to join the village. And we had about 75 responses back, which very happy that we had 75 folks say yes, they wanted to join. From those 75, we selected another 25 to have an invitation to not only join the village, but also act as what we call founding members. So let's say a focus group of family child care professionals from being newly licensed, pre-licensed, or established and well-seasoned in the work that they do. We wanted to glean from their experience, their knowledge, their needs, and their wants to inform and promote the establishment of the village and make sure that we were doing this for our family child care programs and by our family child care programs. So we had our very first founding members meeting in February after we had a soft co-launch with a sister program, which we call the BOSS. So the BOSS focuses on the business support side for both FCC and center-based programs. But we had that soft co-launch in January. In February, we had our very first founding members meeting. February 10th, we had our very first kickoff. We had an event that was wonderful. We had a guest speaker, which we're going to get into in some other slides here coming up. So from there, we partnered with Groundwork Ohio, partnered with their partner, Laura Storytelling, to help to enrich our programs and the ability to share their story, to speak their truth. So we continued our conversations and events throughout the month of March. And then now that we are now in June and we went through May, we have some wonderful and exciting things that are going to be coming up. So that's just a real quick summary of what you're going to see in our upcoming slides. All right, next slide, please. All right, so we have a very full house. So we have two groups that are basically, actually three groups that are partnering together to provide services to our family child care professionals. So we are collaborating within our own agency to make sure we have a full and rich experience for the village. We have a collaboration between our in-home family child care food program, the CCFP. We also collaborate with the BOSS. We collaborate with our Step Up to Quality team, which is our state's quality rating and improvement system. We also have a collaboration with our pre-licensing team. So all of those teams work together to make sure that there's not one area of an FCC program that's not being covered or supported in some way through the membership in the village. So we're really excited to see how these collaborations can continue to expand throughout our agency as a whole, but actually get that feedback too from our FCC programs about their experiences with being in the spotlight, being featured, and being cared for by Action for Children. So next slide. So the very first thing that we've done, we had our pre-launch come about. So we were so excited to have the village up and running. We have been holding on to and nursing the village for a very long time, getting ready for our launch. So when we had our pre-launch, we wanted to do this well. So we got together and we made kits, welcome kits, t-shirts were designed. I had a sweatshirt that was thrown in there as an extra during those cold months in Ohio, but we hand packed everything. We made sure that each program asked, what do they need? What size do they wear? We had these specialized kits made with, mini booklets, buttons, hot cards, even lip gloss, little things that we knew that our FCC programs would enjoy and put to good use and feel special and cared for by receiving. So the kits were delivered to the founding members at our first meeting, and then they were also delivered to the village as a whole at our very first event. Next slide. So our founding members meetings, we developed a workbook for our founding members, which goes through different areas of an FCC program, the professionalism, going through the resources and supports that they need, the technical assistance, the social, emotional, mental health services, being able to collaborate and network within the community, and also learning how to advocate for themselves and for each other. So every month we meet with our 10 founding members. So out of that 25 that were initially invited, 10 said yes, and they have been committed to meeting together every single month to just develop a work plan, break out in small groups to discuss topics that are on their hearts, on their minds, or maybe even challenging for them to discuss at all. So we do have support services that we offer to our founding members through collaboration, again, with the other agency or the other teams within our agency and also with our community partners. The founding members are encouraged to connect with each other. Of course, we feed them. We offer them a light brunch or lunch or whatever meal is required. We also encourage our founding members to mentor. So our founding members, some of them do have mentees that they're working with right now. And as they learn and are sharing their experiences and things that they're gleaning from working together within the village, they're passing those things on to their mentees. So we're really excited to see our mentoring program grow throughout the coming years of the village. Next slide. Now at our kickoff, we had a wonderful time together. So this was our very first event. We had a beautiful restaurant experience. We had lovely Italian cuisine. We had Dr. Deanna Wilson, who's a mental health professional. She spoke about taking the S off your chest. That was the topic, as a lot of small business professionals, especially women, will carry this S on their chest and expect to do it all like a superwoman. So she talked about, how to take that S off your chest and put it back into your self-care, how to support yourself as you do this really important work of providing high quality childcare services. So we had lots of laughter. It's a lot of just coming out of, post-pandemic. It's nice to see all the faces together and watching the community within the village learn how to say hello, what's your name, where are you located, and then just giggle and laugh and make friends and share contacts. I mean, it was just a wonderful, lovely event. Okay, next slide. Now, during this event, we also we had some short presentations that were given by the other members of, we call it our Child Care and Education Initiatives teams. Those are the teams that we partner with and collaborate with within the village. So we had short presentations. We made sure each of the village members were aware of all the services that Action for Children had available to them, either through the village or through the agency as a whole. We just enjoyed being able to hear their feedback. We even asked, what do you need? What's your wish list? We took notes, we listened. We tried to listen with both intent and also with empathy. Some of the ladies, based on the topic, they shared some things that were very tender and coming from a vulnerable place about their own self-care and how they're carrying things that they're really looking to relieve in some way. So we were there just also as a listening ear, as a support, and also as a resource. But there were bonds made during the evening. So and those bonds and having that openness and community feel really was a wonderful foundation for the village to move forward and start building upon. Right, so at this point, I'm going to go ahead and pass on to Sarah Zhang, our coordinator for the village, to share about the things that we've been doing since our first kickoff event and where we're going. Sarah?
Thank you, Alicia. Like Alicia said, my name is Sarah Zhang with Action for Children, and I'm the coordinator for the village, which is, like she said, Ohio's first staffed family child care network. If you can go ahead and move to the next slide, please. So after our kickoff, at one of our founders meetings, which is that core group of 10 professionals that we recruited to help shape our program, we had a speaker come in from lore storytelling. The village founding members were invited to craft their very own impact story. Each member was given a business story workbook. And so Bridget, who ran the workshop, she took them through a journey of finding their own voice through the most impactful memories and experiences that they had used or that they had experienced through their profession. And so they spent some time one just by themselves writing some information down, and then they partnered up with someone to record their story and listen to that story again so that they could hear how they were telling and get some feedback on different avenues that they could take their story to. This session was the first step towards the founding members delivering their impact stories, which will come up on that event in the next few slides. So they will be sharing their stories at our year-end celebration. Next slide, please. So then we had another networking event for the entirety of the village. We went back to the same location as our kickoff event, had a great dinner and brought back the same speaker, Dr. Deanna Wilson. She returned for the second part of her self-care series, which was titled Put Your S in Self-Care. So in the first session, she talked about not being that superwoman. We don't have to do it all, and we have to care for ourselves. So that second session spoke to our members and our participants about putting that S back into self-care. We all know how important it is to take care of ourselves before we can give of ourselves to others. She spoke to our professionals about the importance of taking time for them and encouraged everyone that was there to create a vision and inspiration board. She provided all of the materials to them. And so everyone left that networking event with a great vision board that they could hang up on their bathroom mirrors or on a wall somewhere that they could see it every day and make sure that they are taking care of themselves and not just the families that they serve. Next slide. So we continued our storytelling journey with our founders, with a representative from Groundwork Ohio. They are a statewide advocacy organization committed to the championing high quality early learning and healthy development strategies from the prenatal period to age 5, which we all know is a very important group of individuals and children to work with in our communities. Beth Hess presented to the group just a few weeks ago in May. She assisted them in continuing their story development, enabling our professionals to effectively tell their own stories and advocate for themselves when speaking with influential community members. Next slide. So all of that storytelling practice will culminate in our year-end celebration, which is happening June 9th. So coming up in just a few days. We are feverishly getting ready for that. So we will have 3 of our founding members get up during the year-end celebration and tell their stories. They'll discuss their why for doing what they do, what the village means to them, and how they hope to continue to help other childcare professionals in the community. Also during this event, we have a local film crew that will be finishing up the last piece of a mini docuseries that they are creating for us, and that will also include these stories so that we can share these stories with others outside of the village. Next slide. So the excitement is growing for our next fiscal year. As we are approaching the next year, we're hearing the excitement grow from our family child care professionals. They are looking forward to enhancing their professional relationships, growing their businesses, and gaining even more individualized support from our coaches. And we can't wait to continue to share our journey with you and Child Care Aware of America. So as we are building excitement for the next fiscal year, we have 2 events that are coming up. Actually, a few things that are coming up. One of them I just spoke to, which was our year-end celebration on June 9th, which will take place at the Ohio State University's golf club. We're very excited for that. This coming weekend, we are hosting a garden fest in collaboration with our food program, CACFP. They will learn about nutrition and gardening, and we'll provide them with lunch and some swag bags. There will be an educational piece to that about healthy recipes. They will take home some tomato plants and some flowers. And then in addition to those 2 events, we are able to sponsor our founding members to attend the NAFC conference in July. We are providing full conference registration to them, as well as a hotel room for those nights and airfare reimbursement. So we're very excited for that. Next slide, please. And before we end our presentation, we just wanted to say how grateful we are, and we've been blessed with the opportunity to work with Child Care Aware of America and everyone else in the COP, so that we could learn from what they're doing and help our professionals get the services that they need and the networking that they desire, and help them just kind of figure out how to be good business people, entrepreneurs. And so we're really looking forward to continuing to work with the other staff family childcare networks that we've met, and with Child Care Aware of America. And I think we maybe have one more slide. So where are we going? We are excited to continue to provide personalized coaching for our village participants. They are provided with professional development hours each year that we are looking forward to continuing to provide for them. They receive materials allotments from Lakeshore, and we'll be switching to another company coming up. But so after they've had some coaching visits with our coaches, they are given a budget to spend on materials for their programs. We're looking forward to more networking opportunities and community building events. In our upcoming year, we're looking forward to adding additional self-care programming, including participant-led yoga sessions. We are really looking forward to researching the opportunity for healthcare services so that we can provide those to participants of the village. Continued work with local advocacy agencies. And we are also wanting to start a participant-only marketplace so that they can exchange materials with each other. We know that a lot of new family childcare professionals are in need of some materials for their program. And so those who are already well established, they have things that maybe they don't need. So we're looking forward to setting up that marketplace so that they can exchange those materials. And as the other networks had mentioned, they are using Basecamp. So we're looking forward to either setting up Basecamp or Google Classroom, something like that, to give all of our participants the chance to connect and have resources available to them whenever they need. They don't need to search through emails for upcoming dates and events, things like that. So we're very excited for the next fiscal year and making lots of plans for that. Thank you.
Thanks, Sarah, and thanks, Alicia, too. One thing that stood out to me during your presentation was the many smiles on the faces of those who are participating in the village. So thanks for sharing, and also best of luck to you. You have some great events coming up. And to thank all of our presenters. You have shared so much work that you've done and the meaningful work that is going into building these staff family childcare networks and benefiting the family childcare providers that you serve. So thank you again. We do have just a couple of minutes for questions. I have a few. You can go to the next slide. This question is specific to Maggie from Illinois. And that question was, is your database actually utilizing Basecamp, or is it called Basecamp?
So we are utilizing Basecamp, and we have like a section inside of Basecamp, the website, that we have our family childcare connections network on it. So we utilize the website through Basecamp.
Great. And then there's one more for you too, Maggie. And that question was, how did you identify and reach potential providers?
So we have a list of potential providers that we currently work with. They reach out and we kind of have a relationship with them through the whole licensing process. So we do have a list of potential providers, but then we also just throughout the year advertise at libraries or supermarkets, and we just put up flyers throughout our communities. So we did it through that, and that's why we kind of included the QR code on that invitation. So if we hadn't touched base with them, they're able to reach out to us as well.
Great, thank you. And the next question was for Colette in Oklahoma. And that question is, are you evaluating whether quality improvement is correlated to participation in a network?
So we are, to some extent. We will probably be looking at other additional ways to measure that. For now, what we have set up is anybody who is doing who accepted Brightwheel from us, the software management system, or who ask to do accreditation that we provide a self-study kit to. We do have a self-assessment that they complete with their business consultant, and then we complete it at different time frames throughout the next 3 years to see if those scores improve. We're mostly focused on the business practice, though, not on the early childhood practices and the developmental practices. So we're going to look at that some, but our R&R coaches will come in and do that. So from this program, we're really mostly focused on the business practices.
Great, thanks, Colette. And then there's a question that we've had actually throughout our work together that I thought would be a meaningful question to ask here, and that's for Alicia in Ohio. And we've talked about how fast the village has evolved with increased staff, creating policies and procedures, and then also shifting and tweaking services based on provider feedback. And how have you managed that?
Well, we really have to approach the establishment of a staff family child care network with a lot of patience and a lot of grace for all parts. So we know that you can have things planned out to the very last dot on an I or a cross on a T, but when we gather that information and we start actually moving forward in those plans that we've made, having the flexibility to basically just shift our focus, shift our plans to be flexible. So with the village, we've had plans that we've said, okay, we're going to try for our first year, and then we're going to come back to the table. We're going to first ask the participants and members of the village, what did they think? You know, did this work well for them? Then we're going to ask ourselves, look at the data that we're collecting. You know, we're doing surveys. We have an interest survey, an entry survey, and an exit survey, and collect that information, add it to our own experiences, and making some changes and being okay with that. You know, thinking about a staff family child care network as something that's established and then it just stands. It's more like it is a home, basically. It's a home away from home for a lot of our programs, but it's more like a mobile home. Like we have to keep moving, we have to keep changing, we have to keep relocating, and being okay with that and being comfortable in that space. So that's the best that we can do right now, but it is a journey, but having that patience and that grace and that vision and making sure that we're making informed decisions, that's the key. That's the key.
Great, that's great advice. Another question just actually came in to Alicia for Action for Children. Are the state's quality seating system or are R&R coaches just from the R&R separate from the state quality program, and how is it funded?
Okay, let's see. Are you the state's quality system? So Action for Children is Central Ohio's resource and referral agency. So we do manage the state's quality rating improvement system for our service delivery area. And for Ohio, that's a step up to quality. So we do have funding available through the state because each service delivery area for our state is divided, and we have different R&Rs for the different areas, but we all operate under the same funding with the same mission for our quality rating and improvement system.
Great, so you live under the same roof.
Yes.
Okay. And then I think one more question for any of our presenters would be, is there one tip or a piece of advice that you would share when you are creating a staff family child care network, since you've all gone through it in the last year? Any words of advice or wisdom? And this is open to anyone from our presenters.
I'll share.
Okay.
So my tip would be, it's okay to take your time and plan. You don't have to just jump in with both feet before you get your answers done. So take your time, plan it out, and then jump deep. And if you get thrown in without the planning, then just swim and make it happen anyway.
That's a great advice, Colette. Anyone else from the presenters? Maggie?
Yes, I would say to be open to new ideas and the idea of change, because with this, you'll have a bunch of different things coming and you can't really prepare for it all, but those ideas are ideas from your providers and who you are looking to grow with. So just encourage a change and open communication.
That's great. The provider voice is so important. It looks like Sarah's coming. Oh, hi, Sarah.
I was just going to say to be ready to learn as you go. We say very often at Action for Children that we are flying the plane as we're building it. So just be ready to learn and shift quickly. But it's so rewarding that those changes are, they're necessary but they're so beneficial once you take a step back and listen to what your providers are asking for.
Great. Thank you, Sarah. All great words of wisdom from our panelists today. I want to thank each and every one of you that joined us, our presenters, my colleague Anita, and all of you as participants. I thank the presenters for sharing a glimpse into the journey that they've had over the past year, giving family child care a voice at the table while validating and enhancing their profession and really truly supporting the needs that they have through these well-designed and implemented staff family child care networks in their states. The only other question I see is if we'll be sharing this PowerPoint, you will receive a follow-up email from this presentation with the slide deck as well as an evaluation component. You should have actually also already received an evaluation link in your email. And we really ask that you take time to fill that out as we value your input and use your responses to inform our future work. And if you'd like more information on technical assistance provided through Child Care of America, you can visit our website and you'll see a TA tab that you can click on with our information. And I think that's it. Thanks again for everyone joining us and have a great end of week. Oh, and for those that are still here, there's a resource page that you'll also receive with embedded links in your follow-up email. Have a great day, everyone.